Post-operative surgical care for my patients varies dramatically if I'm dealing with an elective unruptured aneurysm versus a ruptured aneurysm. So an elective unruptured aneurysm, my patients typically go home the next day. The most important part of the post-operative care is medication compliance. And so this is something that my patients and myself discuss extensively before we go into surgery to ensure that they understand the importance of taking what we call dual antiplatelet therapy after treating an aneurysm electively to secure it, to keep it from rupturing. If I'm treating a patient in the hospital setting, in the inpatient setting for a ruptured aneurysm, it's a very different story, and I rely very heavily on a multidisciplinary approach with the ICU team, with myself and the neurosurgery team, with the neurology team, with the hospitalists, and then physical therapy and occupational therapy and speech therapy. It's a whole unit of people dedicated to enhance the outcomes of patients who are critically ill when they come in with a ruptured brain aneurysm or an ischemic stroke. And the rehab piece is very critical, and oftentimes the difference between when I first meet a patient in the hospital to when I see them at 6 weeks or 6 months after their stroke or aneurysm rupture, it's a dramatic difference, night and day, and it's not really because of what I did. I fixed the stroke or the aneurysm, but it's the rehabilitation process that is a team effort that leads to the optimal patient outcome.